Hey guys, I want to welcome you to a very special episode. We have Cynthia Thurlow on, and our title today is How to Protect Yourself and Your Family from COVID-19. So, welcome, Cynthia. Tell listeners a little bit about yourself before we get started.
Yeah, thanks so much for having me. So I am a nurse practitioner and my background is in ER medicine and cardiology, but the last few years I've been kind of in the entrepreneurial space and have kind of positioned myself as really as a nutrition and intermittent fasting expert. And I was really excited to come on today and help your listeners figure out some strategies for supporting your bodies in a very healthy way, and try to navigate this new normal that we're all kind of experiencing. I know my own house, we were talking about this before we jumped on, with two middle school boys and a husband who also works from home and two dogs. That has really been a lot of togetherness and trying to keep everyone healthy and sane at the same time.
All right, so let's dive right in. What are your top tips of how to keep from getting COVID-19?
No, I would say first and foremost, it's really critical to do social distancing. I know I walk through the neighborhood every day, which is completely fine to do with at least one or two of my dogs. And I still see a lot of teens and young adults kind of congregating. So the social distancing piece, although I know it's a terrible inconvenience, is really designed to protect all of us from transmissibility of the virus. And so what I encourage people to do is to really stick to the strategies of, only leaving your house for things that you really need to do, seeking medical care if you have a doctor's appointment or something urgent that you need to have evaluated, or obviously an emergency. And, really being diligent about when you're leaving the house to go grocery shopping. A lot of grocery stores where I am in Northern Virginia are specifying times for people over the age of 60. So you want to be respectful of that. They are the ones that are most susceptible to complications from COVID-19, but also, really being cognizant of where you are in a grocery store. I've gotten very purposeful and very deliberate. I try to order all of my pantry items online so that I'm not spending a lot of time in the grocery store searching, going up and down the aisles. I try to be very deliberate about menu planning, which is something I'm probably not as good with as many other people are. For multiple reasons, but so that when I know that I need something, it goes on a list. We've got a whole system. I have teenage boys and they eat us out of house and home. So really being deliberate when you go to the grocery store, knowing exactly what you need, not standing too close to people, really keeping that 6 foot or larger radius, and just being careful when you're checking out. I know my local Whole Foods, the people there are wonderful, but the checkout lines are very close together. And so have had to kind of position myself. Sometimes I go around the counter to do my payment as opposed to being right back up next to someone that's on the opposite cash register. So I would say those things are critical, social distancing. I think it's really important that you're getting plenty of sleep. I would be the first to admit that I'm really good on a normal basis of getting 7 to 8 hours a night of sleep, but let yourself sleep in without an alarm clock. Now is the time to really maximize sleeping in. And by this, I don't mean sleeping away your day, but sleeping in, letting your body wake up naturally, waking up to sunlight or however is your preferred method. Sometimes it's a dog jumping on top of me or a kid jumping on me, or jumping on the bed. I would say sleep is really critical, managing stress as best as you can. And I know that that's different for everyone. In our house, we're a very active household. So obviously not being able to go to football or CrossFit or some of the other sports, my kids are competitive swimmers, has been a big adjustment, not being able to get to the gym for my husband and I. So we kind of cultivated a home gym and then just remaining as active as possible. You'll sleep better, helps reduce your stress, and then finding other ways to decompress, because whether you're an introvert or an extrovert, we all need a little bit of alone time. And sometimes that can be challenging even in a household. So whether it's reading a good book, whether it's meditating or doing gratitude journaling, just connecting or praying. Right now, our local parish, I'm Roman Catholic, is actually offering services online. So you can actually see what's going on. It's also Easter, so a kind of holy time in our community. But, finding ways to connect with others, the really cool thing about technology, just like Zoom, like how we're recording, is that you can still connect with your loved ones. I would suggest if you're feeling really socially isolated, getting on with girlfriends or friends, connecting with your family members. Maybe like my parents can't see us right now because they're obviously older than 60. So making sure the grandkids are getting out with the grandparents and staying as socially connected is really important. I would also say that the nutrition piece is critical. And by this, it's very, very common when we get stressed, we kind of gravitate towards certain foods, whether it's, salty carbs, sugary carbs, those kinds of things. And there's a place for having fun food. I'm not telling anyone not to enjoy some popcorn or a little bit of ice cream, but the point is that we want to make sure that the foods that we're eating are actually going to providing the most benefit. So really healthy, nutrient dense, whole foods, when I'm talking about protein, like grass-fed beef, whatever your budget really allows you to do, wild caught fish, chicken and bison and things like that, but also incorporating some healthy fats. And then when you're incorporating carbohydrates into your diet, I would suggest things like root vegetables or sweet potatoes, or even a baked potato over, rice and pasta. I know my kids in particular can, wolf down an entire pound of pasta like it's nothing. But it just doesn't fill you up. And for teenagers and people who are growing, probably not as much of an issue. But for those of us that are adults, I would recommend, getting your carbs from the things that I've mentioned, but also low glycemic berries. We stocked up on a lot of frozen organic berries because we knew that we would want those things, but they're really hard to keep fresh in the refrigerator because they spoil really fast because they're organic. But really just being mindful about the way you're eating and trying to determine, like, am I bored? Is that why I'm craving something? Or would I be better served by going for a walk? Or do I just need to indulge a small amount of dark chocolate or something? Not so that you're feeling deprived, but don't derail all the hard work that you're doing throughout the year. And we know that, a lot of sugary foods can impact immunity in a negative way. So when you're planning your menus, when you're looking at the foods that you're going to be incorporating into your life, I always say lots of color. So brightly pigmented foods. There's a lot of phytonutrients, which is a fancy way of saying there are chemicals in, bright red peppers, lots of vitamin C, eggplants. I mean, just brightly pigmented foods are going to give your body lots of nutrients that are going to be very supportive. And I always get asked, what specifically do we want to be ensuring we're getting enough of? And I always say vitamin C rich foods. So looking at, citrus fruits are great, easy, lower glycemic index, lower sugar fruit option, whether it's lemons or limes or clementines. Like clementines this time of the year are amazing. And we are going through a lot of them because they're so sweet and so satiating, but also thinking about things that are vitamin D rich, meaning getting out in sunlight is going to be helpful for immunity. Those fatty fishes, it doesn't necessarily have to be fresh tuna. You can do pole caught tuna. You can do sardines. I have a really great sardine recipe if anyone's interested. Vitamin D rich foods like some of the seeds and nuts as well, but just really thinking deliberately about, it doesn't have to be that you are sitting down and obsessing over this, but just making sure that you're getting some of these foods, vitamin C, vitamin D, zinc. Zinc is found in shellfish, lots and lots of options that can be helpful. And one of the things that I've been hearing as a kind of anecdotal bit of evidence about COVID-19 is that some people, when they first develop or are exposed to COVID-19, one of the first signs can be a loss of sense of smell, which can be correlated with zinc.
I've heard that.
Yeah. And so definitely want to be, just mindful. Of course, everyone automatically asks me, what supplement should I be taking? It's really hard right now. Maybe not vitamin D, but finding vitamin C powders, finding zinc can be very challenging. I was telling someone the other day that an order I placed with a pharmaceutical company, I'm still waiting, and I'm a healthcare provider. I'm still waiting 2 weeks later. So it gives you some sense that people are really, wanting to include some supplements into their diet. And if you can find them, that's great. But for most of us, we're really constrained also by the social distancing, but also places like Amazon are just, they're sending out the most important things that people are ordering and holding back on a lot of other stuff. So, orders are taking way longer than anticipated, but that's a good start. I would say those are things I would focus on first. And then the other things you can tweak. But I would also say, if you have to go out of the house, this is what I've been doing. I would not recommend that anyone wear a surgical mask or an N95. Leave those for the healthcare providers, please. Most of our healthcare providers don't have enough equipment right now, and they're on the front line. But what you can do is you can still cover your face. Like my son and I had to go out for an orthopedic appointment on Monday, which was pushing every one of my buttons because I didn't want to do it, but he had jammed his finger and we needed it to be looked at because I didn't want to take him to the ER. And we just covered our faces with bandanas. And we know that that can even be beneficial, still keeping that 6 foot, distance from other people, but keeping your face covered if you're out in public, if you need to go out in public, is not unreasonable. And actually, I believe the CDC is going to be updating their recommendations. But again, surgical masks and N95s, please, please, please donate those to your local hospital. We want our healthcare providers protected. They're the ones on the front line. They need to be protected most of all.
Hey guys, I'm on my way home from being on national TV talking about intermittent fasting, and I'm answering the question, does intermittent fasting help you lose weight? Maybe you guys have tried intermittent fasting and lost some weight, but now you might just be stuck in a rut where you're not losing as much as you want. Well, I've interviewed over 1,000 thin eaters, and I've learned that intermittent fasting is just one of the tools they use. But there's so many more. There's 9 other principles that they use to stay thin. To get out of your rut, click here to watch this free video. I'll put my favorite vitamin C powder that I use in the show notes, but tell us, the zinc that I love is completely out. I can't get the zinc that I want. What is your favorite vitamin C, and what's your favorite zinc that you love?
Yeah. So, for vitamin C, like as an overall one, I like liposomal vitamin C. It's a little more bioavailable, meaning our body can more readily take it up. And so Quicksilver makes a great product. You have to keep it refrigerated. But right now I'm using Biotics mixed ascorbate. So you get a lot of different variations of bioflavonoids and vitamin C. And I'm taking that along with another product that unfortunately I'm trying to get carried, but I'm still struggling with the manufacturer to do that. But we want to keep our histamine levels low. So vitamin C can be really integral in that. In terms of looking at zinc, zinc glycinate is one that I typically am using, not really specific to any one manufacturer. I use quite a bit of zinc carnosine, which is different, mostly for gut health. And I do have preferences there. But I would say the other one that can be really beneficial is vitamin D. Most of us are vitamin D deficient, and that is involved in immunity, also in blood sugar regulation. So that particular brand, I have a couple, but I've been using a lot of Orthomolecular's products, really nice quality. But most of us are deficient. So you really have to know what your levels are. We really want them above 50, closer to 75 would be great. But most of us are hovering, if you look at statistical data, most people are hovering in the 20s and 30s. And that really opens up your susceptibility to getting, not only just getting a common cold, but obviously would impact your immunity for COVID, because it really is so highly infectious, far more infectious than I think most of us initially realize, which is why it's kind of spreading like wildfire.
Let's talk a little bit about all the different types of zinc. I don't think people realize that there are different types of zinc, right? Like there's zinc gluconate, there's citrate, there's orotate, there's sulfate. So talk about what are your top 3 favorite ones again, and what is the best for keeping your immune system high?
Well, I would say first and foremost, I always say whole food sources first. So, eating the zinc rich foods, and I can certainly, give you some additional examples, but I would say zinc carnosine is the one I use the most because I'm usually working with digestive health, and that can be incredibly soothing and can also be a precursor to hydrochloric acid. And hydrochloric acid is something that's secreted in our stomach to help break down protein. But as we get older, as we get closer to 40, we produce less hydrochloric acid. So it can be hugely beneficial for supporting the body in that way. Zinc glycinate is generally the one I think about when I'm thinking about immune support. And oftentimes I'm using products that have zinc in addition to other minerals in them, because I find if I can find one product that has multiple minerals in it and it's one product as opposed to 4 or 5, that oftentimes will get better buy-in from my perspective. I don't use a lot of the other zinc products, largely again, because I'm using combination products, and I'm really encouraging people to use the whole food sources. Now, for those of us that can get fresh seafood, when I always think of zinc sources, I'm always thinking about shellfish in particular. So if you're able to get access to mussels and oysters and things like that, that is probably one of the best ways. And then, looking at, grass-fed beef, organ meats. I mean, those things oftentimes are really great sources. Pumpkin seeds, pumpkin seeds that are salted are really delicious. If that's something that appeals to you, it's also a healthy fat. So there's a lot of really good benefits. I'd love to hear what zinc that you're currently taking. It sounds like you're pretty zinc knowledgeable as well.
Yeah. Well, and again, I like to try to eat my zinc as
Mm-hmm.
much as I can because that is the best. And I I think eggs are pretty high
Mm-hmm.
in zinc. Some dairy is, which I'm not eating any dairy right now. But some dairy is really high. And yeah, like pine nuts, peanuts,
Mm-hmm.
cashews, almonds are really good. But I would say when I feel the best is when I'm having meat because meat is really an excellent source of zinc,
Mm-hmm.
and shellfish um, is really high. I mean, if you take uh, an Alaskan crab, I think that it has like, I can't remember exactly, but it has like 7 points something milligrams,
Mm-hmm.
per 100 grams. So it's like, that's pretty good. And then shrimp, I think shrimp is really good. So I like that. And even some beans. So
Mm-hmm.
chickpeas, lentils, they have a really good amount of zinc. But the kind that I love is the kind that is it dissolves in your mouth.
Mm-hmm.
And so you literally just take it and it dissolves. And off the top of my head, I can't,
It's
now
like,
that you asked me,
it's
like,
like,
I know that brand right off the top of my head, but for
Mhm.
some reason it'll hit me in like a minute,
Yeah.
but it just literally, and it tastes really good. You just take it, it dissolves right in your mouth and it tastes great.
I wonder
And
if it's
I'll
aqueous.
remember it in just probably a couple minutes.
Yeah, it's interesting. When I was in my nutrition training, one of the tests that we did on one another was with aqueous. So it's water, it's like a liquid zinc. And you could tell if you were zinc deficient depending on how it felt on your tongue, if it felt fuzzy or if it was really bitter or if you had no reaction whatsoever. But I think many people just don't realize how important zinc is for the body. Really, really critical. And certainly something, and given the pandemic that we're in, certainly something people want to be thinking about, not having to be paranoid, or running out to get a supplement, but just making sure you're incorporating those foods into your diet. The one caveat I would say is that mycotoxins, so things like corn and peanuts, can be problematic for mold. And so I like to remind people that in this kind of pandemic culture that we're in right now, we really want to be cognizant of avoiding moldy foods. And so the two that I think of that are most prone to mold that are in a lot of foods are peanuts, which I know are delicious. I'm going to get hate mail for that. But also corn, which seems to be at the basis of nearly any chip that's out there. In my house, chips are definitely healthier versions of chips are definitely a high commodity item right now, but we're really trying to steer away from as much corn and peanuts as possible, largely because of the mycotoxins. Again, the mold issues, we really want to be cognizant of them and avoid them as much as possible.
Hey guys, one of the things that will take your weight loss to the next level is coaching. You can either work one-on-one with me or one of our certified private coaches. If you'd like, you can schedule your free call. It's a 10-minute strategy call just to see if coaching is going to really take you to the next level. The other thing is listening to the audiobook. Listening to the audiobook and getting the video course that I've done, people are seeing dramatic results. If you just listen to the audiobook 30 minutes a day over and over and over again and get the video course, go to chantelrayway.com and check out the video course. You won't be sorry you did. I want to tell you about a great product that you absolutely cannot live without, and it's called Digest Aid. When you're stressed, you might not be able to produce as much stomach acid. And if you're eating a little more right now and you're stressed, you need help to digest your food. My Digest Aid that I created has enzymes that are capable of doing just that. It has both betaine HCl, not just HCl, but an enzyme pepsin that helps your body digest your food, which is really unique. And right now, all of our products are 30% off. Go to chantelrayway.com, click on store, and get yours for 30% off. Just use the promo code podcast. I know what it is now. They're called Life Extension is the
Oh,
brand. And
interesting.
they're enhanced zinc lozenges,
Okay.
and they are $9. Like they're not
That's practically free.
expensive.
Yeah.
And they're peppermint flavored. And so even my son loves them. And so
Oh,
we'll take them and kind of freshens your breath at the same time. So let's talk about creative ways. It's funny because I had 2 Peloton bikes probably about 6 months ago. I decided to sell them because I
oh
was like,
no.
I'm not using these. And so I decided, it's funny because me and my girlfriend, we decided, we hired a friend of ours that's a personal trainer. Went outside, we stayed 6 feet apart. He stayed 6 feet apart. We
Mhm.
were outside. Obviously you can take some walks, but what are some other things that creative things that people could do to get their exercise where they're still in community with other
Mhm.
people, but they're not, at risk?
Well, I think it's challenging right now, honestly, unless you're doing something outside and being really cognizant of the space issues. We've gotten creative at my home, and obviously, as a family, we can all be in close contact with one another. But things like TRX bands, if you've got TRX bands, those are body weight bands that are really incredibly challenging, far more challenging than people think they might be. We've got kettlebells and plates and medicine balls. And there's a really interesting and I just bought it when I bought the TRX bands, because I could see the writing on the wall that the gym was not going to be something that we could be necessarily doing indefinitely, given what was starting to happen here in the United States. And so I got online, and there was actually a group of cards, and so it's all about body weight exercises, so things you can do with that equipment that can actually give you a really good workout. And so there's probably like 60 cards, and it's all these different workouts that you can put together. And so my kids have started doing it with me. And one day might be legs, and one day might be upper body, one day might be core, and one day might be a HIIT session. And so I think really the way to not get bored of what you're doing is to have some creativity and change it up. So some days I focus more on strength training, some days I focus more on HIIT. And then, the other piece that I'm really, really cognizant of is it's very easy if you're in the house to not be doing a lot of walking. And one of the ways that, I intend to not gain the COVID-19 while being stuck in my house is that I endeavor to do anywhere from 3 to 5 miles of walking a day, and usually with one of my dogs who loves it. In fact, I think he's never slept so well in his entire life. But we do a loop in our neighborhood, and sometimes I do it with my kids, sometimes I do it without them, sometimes I do it with 2 dogs, and sometimes I do it with one. But you could definitely, if you have a friend in the neighborhood that has a pet, you can absolutely, go on a walk. I mean, obviously that 6 foot span of separation can, be, sometimes you're walking in the straight to avoid running into other people. But I think it's all about just being creative and using body weight exercise. I mean, we also have a treadmill, but we don't have any other equipment per se. And I feel like all of us are still getting good workouts. It's all about something that's short and deliberate, because HIIT or high intensity interval training or Tabata training is designed to be very intense for a short period of time. And then you have a short recovery. So it'd be 30 seconds of intense exercise, 10 seconds of a recovery, and then you repeat it. So you may do, 20 minutes of something very intense, but you're getting a whole lot more out of that than if you're just doing sustained cardio. Like, how many people get on a bike or get on the treadmill and just bang out the same volume of exercise every time. And our bodies are really smart, so they'll actually adapt, and we don't want adaptation. We want our bodies to be challenged. So getting back to your original question, I love the idea that you were able to exercise with a friend. I think realistically for me at this point, my exercising is done with, 2 teenage boys and a very active, healthy spouse and 2 dogs. But we can always change it up. And I think the only way to do that safely, if you're trying to exercise with someone else that's not part of your family unit, is to do it outside, or where you've got enough space where you can all be separated, so that you're not running the risk of shedding the virus. But I also think it's important that we're really not doing a ton of that, limiting our exposure to other people as much as we can, so that we're not likely to, breathe in that virus.
Yes, and you are an expert on fasting. And so talk to us a little bit about how your eating window is. Is
Mhm.
it exactly the same as it was before COVID-19 came? Did you extend your window? And
Mhm.
tell listeners how fasting can help keep your immune system still being high.
Yeah, so great questions. And I get asked this a lot. So what am I doing differently? because I'm not able to be like as on the go as I normally would be, I am actually extending my fast. So I'm tightening up my feeding window, and I'm fasting a little longer. I'm doing about 18 hours a day. And then I'm eating within a 6 hour window, and I'm getting, right around noon, I eat my lunch, and right around 6 o'clock, I eat my dinner. And I can do that right now because we're not going anywhere. Our meals are very planned at this point. And what that's allowing my body to really tap into is I'm going longer with not eating, and I don't feel poorly, but I just think with the lack of consistent activity that it would otherwise normally be a huge part of my lifestyle, I need to kind of help my body. And the way that I'm doing is it's getting a longer amount of time to digest food. You're tapping into autophagy, which you were alluding to, can really be beneficial for immune function because we're getting rid of diseased and disordered cells. And think about it, when you're sick, like if you have a cold, generally you don't have much of an appetite. And it's your body's way of kind of going on reserve. It's working very hard and very diligently to do a little bit of spring cleaning for the cells that don't belong. And that can even include, cells that you might, a virus that you could have been exposed to. It doesn't necessarily have to be COVID-19. So, from my perspective, when I'm fasting, I'm more attuned to being hungry. So I know when I'm truly hungry and when I'm not. I don't have as many cravings when my fasting window is really tight, and I just sleep better. So, for all the things that we've talked about, like sleep is really critical for immune function, eating the right food. So if I'm not craving junk and I'm not eating it, then my body's really able to use the really good quality food that I'm consuming to be able to fight off or ward off an infection if I'm exposed to any, type of infectious. It doesn't necessarily have to be COVID. But I would also say that I'm finding people are more receptive because they're home. They can be more mindful. They can also be more tempted. So I just encourage people to, when I'm craving something sweet, I will go for that clementine first before I grab chocolate. And, have I had days where I've eaten more carbs than I normally do? Absolutely. But then I flipped, and the next day, maybe I've done one meal a day instead of two. And I don't advocate one meal a day on a normal basis for most women, but I do have male friends that do that very successfully. But I feel like maybe I've gotten off course, or maybe I didn't eat the way that I wanted to the day before. I jump into just one meal a day, and then I pop back into my normal feeding and fasting window. And I feel like that kind of resets my body enough that I'm kind of like, okay, today I know I don't need as much food because the day before I went a little overboard. So it helps me kind of steer the ship, if you will, a little bit more easily. And I find that keeps me on track. And here's the ironic thing. I was talking to a woman this morning who said, I've been wearing leggings every day since this started. And I told her one thing I think that's really important. And I'm an advocate of wearing comfortable clothing, especially if you're working. But every couple of days, I will put myself into what I consider to be my tightest pair of jeans to kind of make sure that I'm still being honest with myself. And if I feel like they fit the way they normally do good, then I go back to my normal wearing Lulu every day and feeling completely comfortable doing it. But, just have a barometer or some way of kind of checking in with yourself to be honest and say, okay, I didn't do a great job today. I can do a better job tomorrow. And just recognizing that you don't have to, you can continue to set yourself up for success, even if you're homebound, like all of us are.
Yeah. And the thing is, if people are just thinking about doing a longer fast, now would be the
Mm-hmm.
time that they really should try to do it, because they're not running around, they're in a relaxed state. And I mean, there's study after study, like you said, that
Mm-hmm.
have found that fasting lowers your white blood cell counts, which in turn triggers the immune system to
Mm-hmm.
start producing new white blood cells. And so, they've said that a 3-day fast could essentially reset the immune system altogether. And
Well,
so, go ahead.
oh, sorry. No, I was going to say, so I am always an advocate of people, if they want to do a 2 or 3 day fast, I think that's a great idea. What I'm finding though, is there's a lack of consensus between healthcare providers about doing prolonged fasts in this pandemic, that
Mhm.
doing a 24-hour fast or less is good right now, but doing a longer one, I'm not sure it necessarily is beneficial. And I say that with great respect, because I was tweeting something a few weeks ago, and someone presented some research from Dr. Attia, who's one of
Mhm.
the intermittent fasting
Yeah.
guys. And, I listened to the video, and I actually said, it's all speculative. I mean, of course, we don't know definitively, but I was like, probably right now, I think, if you want to do a 24-hour fast, I would say absolutely fine. If you want to do a longer fast, we don't know right now what impact it has on, prevention of COVID. And so that was the concern, like the distinction. Under normal circumstances, I love a 2 to 3 day fast. Given what I'm starting to see, there's a lack of consensus. So I think a lot of people are just trying to figure out what's the best recommendation at this point in time. I think, extending your fasting by an hour or two is a great strategy. Maybe doing 1 meal a day on occasion, maybe doing a 24-hour fast. I'm not sure the research, and it could be an N of 20, but I'm not sure the research right now really is telling us whether or not that is protective against, COVID. In the future, we may know, but I think because this virus is so new and novel, we just don't know. Yeah.
So. Right. Awesome. Well, this has been amazing. Tell listeners where they can find you and where they can follow you.
Yeah, thank you. So on my website, www.cynthiathurlow.com, I am active on Instagram and Twitter, same name. And I do have an intermittent fasting group. It's a free group. It's open to anyone. That's on Facebook. It's Intermittent Fasting Lifestyle /Cynthia Thurlow. I know super, super original to have that name as a title, but definitely we do some great work in there.
Awesome. Well, thank you guys so much for being with us today. Cynthia, thank you for being with us, and stay tuned. We have another episode coming up in just a few. Bye-bye for now.